go strong after that.
Welcome back to the Morning Blend. Robotic surgery is one of the best advances in medicine today. It allows doctors to be very precise, and patients have less pain and quicker recoveries. This new age procedure is especially good for men who need to have their prostates removed.
Yeah, Dr. Matthew Johnson is a urologist with Aurora St. Luke's Medical Center. He's part of a team of doctors who have performed more than 3,000 robotic prostate surgeries in just the past 10 years. And Patrick Bauer is one of his very happy patients. Nice to see you both.
Good to be here again.
Yeah, 3,000 surgeries. Molly was kind of grilling you. How many did you do yourself?
Well, not all of them are prostate surgeries. We do a lot of things with the Da Vinci robot. But last month was our 10-year anniversary for robotic surgery, and we were the first in the state to do it. So it was an exciting time for us, and it's been a terrific decade. I mean, we've really grown with it. There's a lot more applications, but the main thing is the precision and the efficiency of surgery when you're using the Da Vinci robot. Rather than making bigger cuts or even using old laparoscopic instruments, we have these really tiny instruments that we use through small incisions. We can do all the work with very little impact to the surrounding structures, for prostate surgery, for the continence mechanism, for the potency mechanism and all that stuff. And patients do very, very well. Their recovery time is faster and they have fewer complications.
See, I think I might have a future in being a robotic surgeon because if the talk show thing doesn't work out. Because I actually tried one of them, you know, where you can look through the little camera, and I think I was able to move a grape and maybe peel a grape and kind of do something. But I think this technology really is valuable for doctors because they're that much more precise. But what it means for the patient is that they, you know, with prostate cancer in particular, men very often experience incontinence as well as impotency. And I think that's to be able to alleviate those side effects is incredible. And the recovery is so much faster.
And so that's why we brought Pat today, so he can talk to a little bit about it. And it's, you know, we have a lot of grateful patients, and he was very kind to agree to come on the show with us today.
Patrick, it's been 5 years for you, and you've remained cancer-free. What was the surgery like for you, and how has it affected your life moving forward?
Well, you know, if I can back up just a step before that, because when I was first having some issues with incontinency and you know, interruption of stream and such, you know, for a lot of men, it's a more difficult thing to even embarrassment to talk about it. For me, it wasn't so much at all. It was an irritation. It was something that was making me anxious, like what's going on. And my primary doctor, Dr. Matthewson, was you know, monitoring my PSA levels. All of a sudden, they took a jump. He handed me a business card and said, "You go see these guys over at the urology department." And when I got tested, which was not a difficult test at all to check it, they found out that I had a level of 6 on this Gleason scale. And Dr. Johnson, when we met with him after the radiologist, my wife and I decided that's the way we wanted to go, get the cancer out if at all possible. I was young enough, healthy enough after he found out that I'd had another surgery there previously and knew who my surgeon and cardiologist were. I went through it. I mean, it was a case, get rid of it if we can. Unfortunately, the Gleason scale jumped. It went to a 9. So when they biopsied the prostate later. So the timing on getting it out, that later October of 2008, was really important, really good. And since then, everything has been very, very good.
I think that's a wonderful story. What is the Gleason scale or the score? How important is that? And should men know that?
Well, first of all, let's take one step back. Prostate cancer screening has gone through some evolution these last couple of years. And I think without getting into the details, the emphasis is on the conversation with the primary doctor. And the primary doctor may even have a conversation with the urologist. And things like PSA and urinary symptoms can come into play when deciding whether somebody should be screened or sent to a urologist. When a biopsy is done, the pathologist will tell us what the grade is. The Gleason score is a way that we grade prostate cancer. It's unique to prostate cancer. But there are other grades, and people usually are familiar with the terms high grade or low grade. Pat had low grade cancer when we biopsied it. When we took the prostate out, we found a whole bunch of the high grade prostate cancer, which is actually very unusual. That's not the, you know, that would be, it happens, but it doesn't often happen. And we use that grade of cancer and exam and sometimes x-rays and the PSA to determine the risks that a patient has, whether they're high risk or low risk. It's pretty simple as that. And if we determine that they're high risk, then we may offer different kinds of recommendations or strategies for treatment. If they're a low risk, they may even qualify for observation. We observe more patients than we've ever had. But that's a conversation you really need to have individually with your urologist.
When we talked about the number of procedures you're done at your facility, and I think the reason why it's important is because if you're going to have a procedure done that's important with some potential for side effects, if you're doing it with someone who's done it many times before, it's a lot better than going to a doctor who says, this is my first time doing this, let's give it a shot.
This is our new
So I
technology.
think it is important for that reason to know that this is a place where they do this often and they know what they're doing, and the robotic assistance just enhances it that much more.
Right. You know, when we first brought to St. Luke's, Aurora St. Luke's, our idea to do robotic surgery for prostate cancer, they were 100% behind us. And a lot of these technical innovations, they have really embraced and allowed their physicians to champion. And so we're very fortunate to work there, and I think patients are well served by the experience, the duration we're doing, and the number of cases that we've done. We're thoughtful about it. We're very dedicated to robotic technology and using that for men who have not only prostate cancer, but also kidney cancer, reconstructive surgery, things like that. So it's been a real advancement, a real plus for us and our patients.
Well, we're glad that you're cancer-free, Patrick. And here's the information if you'd like more on Aurora Health Care's urology robotic-assisted surgery. You can visit them online at aurora.org/robotic surgery. Thanks so much, gentlemen.